Hi, my name is Grant Saffer. I'm an obstetrician gynecologist at the Epworth Freemasons, and I've been looking after mothers and their babies and women as well in gynecology for many years. Induction just means that there's a time to get your baby out, and the induction is how we're going to do that. And induction is the process to call the end of the pregnancy and it's time for a baby to be born for one reason or another. In order to be induced, first of all, the cervix has to be a little bit open. And then you have a little instrument that just breaks the waters. And then usually we would start a drip and that gets you into labour. Now, sometimes the cervix isn't open. We either use some gel called Prostin, or we would use a little catheter which we feed through the cervix and put a bit of water inside it. That's called a balloon catheter, and we leave that overnight. And then the cervix opens up. Now, it depends on whether you've had a baby before or not. For a first-time mum, let's say your cervix is closed. We've got to prime the cervix, so to speak, in order to make it open. So we'd often start with the induction process, either the balloon or the gel. You start overnight, maybe in the evening, and then you'll stay overnight, and the following morning, mostly your cervix is a little bit open, and we start the induction process. Now, for a first-time mother, once you've started that in the morning, usually takes most of the day. Some people labour faster, some people labour slower, but mostly I think you can expect about 12 hours later you're looking at maybe having your baby. For a woman who's had a baby before, vaginally, the process is much quicker and it's about half of that time. In some cases, the baby's not growing well or there's another medical complication, and really if you wait, the medical complication, the mother's going to get worse, or if a baby's not growing well inside the uterus, your baby's going to be at risk. So really, the induction has to happen. My personal view is that you've got to trust yourself, trust your body, and let the process unfold as your labour progresses. Every pregnancy is different, and it's important to realise that everyone's got slightly different expectations, and it's your own baby with your own pregnancy, and between you and your doctor, you're going to try and work out what's the safest way to have your baby.